perspective. This webinar is powered by Leadway, and I'm excited to welcome us to this very interesting session. I see a lot of comments in the comment section. In Kiruka Iwe, I'm glad to be here. We're glad to have you here in Kiruka. I see Margaret, highly expectant. Yes, definitely. We're looking forward to a very exciting discussion and trying to understand and just get the different perspectives of is remote working healthy. Joshua says he's elated. Yes, we're very excited to have you here, Joshua. It's definitely going to be an interesting session. Yes, Akim, it's definitely going to be an interesting session. And we're truly glad to have everyone here to talk about this very, very pertinent question, especially in this day and age. Welcome, Yinka Olabode. Nice one. Yes, thank you. Mr. Oladende, yes, we're so glad to have you here. Hi, Bukola. Glad to be here. Yes, we're all glad to be here and having this discussion. Ngozi Kolakwa, I can see Ngozi Kolakwa. I work from and I'm happy to be here. Yes, yes. I'm also working from home today, so truly this is a very, very fantastic topic to talk about, especially with our age and with what's happening right now with the pandemic and the society at large. It's very important to have this discussion to see how we can better also improve our working system. Yes, it's great to see you too, Madam Adeoti. Glad to be here. Looking forward, yes, well, definitely looking forward to a very, very interesting conversation. And this is going to be a very enlightening session for us to share our different perspectives and learn from one another. I'm glad, yes, well, hi, Wab. It's definitely exciting to have you here also. Happy to be here, Khadija. We're happy to be here, glad to be here. Hi, Oluwatoyin. I love this perspective of working from home world. Yes, 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 yes. Thank you. We need to keep having this discussion. And we're really, really it's very exciting that Leadway has championed this webinar to create more opportunities for people to discuss, and let's hear from a doctor and even an HR specialist. And this is definitely going to be an interesting session because we have two seasoned specialists here who have a very long years, very extensive with very extensive years of experience in their own field, and this is very, very interesting. Yes, can't wait to learn and unlearn. Yes, so we're gonna learn so much. We're gonna unlearn some myths and misconceptions that we might have had also. And we're really just going to look at it from both sides, the pros, the cons, and see what we can do better learning from these two seasoned specialists. Hello, everyone. Yes, yes, yes. Good afternoon, everyone. Once again, just to say that I am Dr. Lamde Bello, and this webinar is powered by Leadway, and we're very, very excited to have this discussion and champion this discussion for about if remote working is healthy, and to get the perspective from a medical side and also an human resource specialist. Hi, Alabi. Hi, Nuruddin Alabi. Yes, definitely glad to have you here. Definitely looking forward to learn and unlearn so many things from this webinar. So we'll be just so we can, we're glad to have everyone here, and we hope that we will be able to share our different insights. Please, if you have comments, feedback, questions, please just put it in the chat section, and we would take them during the webinar. As I mentioned previously, and I'm sure we've all seen from the posters that have been going around, we have two very, very seasoned specialists here today with us to talk about this very pertinent topic. We have with us joining us today, Omolara Yeko. Hi, hi, Omolara Yeko. Omolara Yeko is a global HR leader, executive coach, and author. She is popularly known as Coach Lara, and she's an accomplished HR field specialist from Cornell University, the USA, and a certified talent acquisition specialist strategist from the Human Capital Institute. She is also an associate member of the Chartered Institute of Personnel Management and a graduate member of Nigerian Institute of Training and Development. She has won several awards for her contribution to the human resource development space and has worked with several large organizations, including DHL and Accenture. She currently sits as the head of HR food division at Flour Mills of Nigeria PLC. Ladies and gentlemen, join me in welcoming our seasoned HR specialist, Omolara Yeko. Coach Lara, can I call you Coach Lara?
It's okay.
Yes,
Thank you
yes.
so much. Thank you, Dr. Bello. I'm
Thank
glad to
you.
be here. And thank you so much,
Very much.
Leadway. Thank you for inviting me. I'm
Thank you
humbled.
so much.
Thank
We're
you.
looking forward to a very, very interesting discussion. To also introduce just a short profile about our next guest, who is also very, very, very known, a very known health specialist, is the one and only Dr. Chinonso Igemba, popularly known as Aproko Doctor. Dr. Chinonso Igemba is a medical doctor, health information specialist, content creator, and digital media specialist with several years of experience. He has an MBBS degree from the Nnamdi Azikiwe University and is currently pursuing a degree in business administration. When he's not in his scrubs or dishing out amazing health content to us all over different social media platforms. He's helping startup brands in the health industry to help improve the health space and make sure that people are doing well in terms of their health. Jeremy, in welcoming, as I've mentioned, I mean this is definitely a very very loaded panel. Ladies and gentlemen, please join me in welcoming Dr. Chinonso Ikemba, popularly known as Aproko Doctor.
Thank you. Thank you very much for having me. I am honored to be here. It's an honor to meet the coach, Mariko. Thank you.
Thank you so much to our great panelists here today. And just to starting moving into the topic, remote working now is the new normal. It's almost everybody is asking for remote working now in their contract now. We're seeing a lot more. This it didn't mean that there was no remote working before the pandemic, but we're seeing now that post even while during the pandemic and hopefully post the pandemic, we're seeing um, more push for remote working. And really, I just wanted to get your view, Coach Lara. Can you just share with us what your experience with remote working? How has it been like for you?
All right. Thank you so much, Dr. Bello, for that question. So I'll share my experience from two different areas. So the first is from my previous year as the HR of Accenture, which was an organization that was into management consulting. I mean, we had started remote working as far back as 2015, 16, thereabouts. So I'll share my experience from that perspective. I would also share my experience from the manufacturing industry where I currently work. There are two different industries because in my former organization it was a lot easier to work remotely given
Yeah,
the nature of our work in the organization. It's largely project based.
yeah,
So initially then remote working got me really excited because it helped me to reduce my commute time. I didn't have a driver. I live on the mainland and I work on the island. So I realized that I got really excited on the days I work from home because I'm able to wake up earlier and most of the time I don't
yeah.
have to go to the office.
Oh, I
Can
think
you
we
hear
had
me?
Yes, 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 we can hear you. Yes, great.
So I'm able to wake up early and I'm also able to get to work earlier. Yes. And then my productivity improved. So that is pre-COVID, I must say. And then I joined the current organization where I work. And
Yeah.
initially, I guess with COVID, as a lot of companies had to review their work structure just to sustain their business and also to continue to drive employee productivity and performance. My organization, where I equally work to, had to come up with a flexi work arrangement, which meant that there are some days that you have to work from home and there are some days you have to work on site. Now, due to the nature of our organization, we are into production and we produce food 24 hours so that we can stay committed to our purpose to feeding the nation. To feeding the nation. What we have structured work arrangements where some people have to come to work, then some people have to stay at home, and then some people have to run shift hours. So, in short, my experience with regards to working from home had given me a lot of insight into how companies can creatively look for ways on how to support employees' productivity and yet ensure that they still continue to work. Because if employees are not working, they will not be able to deliver on the business objectives and KPIs. And, that might also affect the bottom line of organizations. So work from home is our new norm, like you rightly said, Dr. Bello, right? However, it also brings about some challenges and stress. I must also let you know that when I started working from home pre-COVID, is different from my experience working from home with COVID, especially with the fact that my kids had to do a bit of homeschooling during the entire COVID period. It was really stressful. It was stressful. A lot of people were not quite ready for it. I mean, so sometimes I had to look for, okay, where can you stay so that you do not interrupt my meeting, looking for spaces within the house. It brought a lot of stress, I must say. But at the same time, for me, it got me thinking, and it also brought a lot of innovative ideas to better manage myself, especially when it came to my mental health, my mental well-being, and my physical health. I realized the importance of having a proper ergonomic chair from working from home. Normally, I would walk into any store and just get any chair that is anything that just makes me sit. That's fine. But with working from home, I realized there's a need for me to have the right kind of chair to work from home, right? So, yes, it came with a lot of problems for me, but at the same time, a lot of awareness with regards to my mental health, my physical health, and not just me. From a business leader perspective, it also brought in the need for us to think about our employees. How do we better support them now that they have to work remotely? And
Okay.
in a nutshell, that's my experience. Thank
Um,
you.
Thank you so much, Coach Lara. Just building on some of the things you've talked about, I'll be moving on to apropos doctor. So, I mean, as knowing, I'm sure remote working really wasn't any big deal in the. It wasn't a thing in the medical space for us as remote as
Still not.
doctors.
Still not.
It's still not a thing for us as doctors, yes, in the medical space. But what has your experience been like for someone that has worked in a hospital setting and then you do a lot of things outside the hospital setting? What has your experience been like for remote working?
So for me, working in the hospital setting, I needed to combine a lot of things, and this was me sitting for 6 to 8 hours every day, seeing patients. That's when you're not in the clinic. Sometimes when you're in the hospital itself, and you need to go assist in the surgery, 1 or 2 surgeries, and then transitioning to this point where I do most of my work from home. I have a home office. I have a studio. I go out to shoot. I would say I actually love the experience of working from home better than being in the office, so to speak. Yes, we understand that it's not every job that has that luxury of working from home.
Yeah.
Some people have to go to a physical workplace and work from home, but uh, for me, it's been a wonderful experience. I tend to be more quote unquote. I tend to think more goals rather than how much time I spend at the office or at the hospital per se. So, when you are at a physical location where, it's your workplace, sometimes you're just, just looking at, oh, let's just get to 4
When the
p.m.
time, yes, yes, yes.
Yes, so that I can leave this place. But when you're working from home, you think in line of, okay, these are my KPIs. We have HR here. This was the first time in a very long time I've had KPIs. So, so you look at, these are my KPIs for today, and how do I achieve them? And you find out that people become. I'm speaking for myself. I tend to become more focused when I work from home, rather than, I'm not trying to say I'm not a focused person at work, but there is always that discordance between how much time I'm spending, or how much productive time I'm actually spending at work, than how much I'm able to accomplish. So if you would ask me to choose, I'd say both, because there are times I actually long for the communal office space where I want to interact with my coworkers. I want to meet new people so that I don't get depressed or feeling like I'm out of touch with the world. So it's a balance.
Yeah.
I want to be at home today. The next day I go to the office.
And actually, building on what you said, actually, that's very, very key about that balance, because yes, working from home, you get to spend more time with your family. There's that more time for social interaction, which may actually help you feel better as a person, and like
Yeah.
just generally improve your mood, your health generally. But then you're missing out of that factor of not interacting with your colleagues, because it
Yeah.
does have an effect also. When you're working with your colleagues, you can just easily walk up to that person's desk and just
True.
share, get feedback about something. So
True.
it's tricky really, that we get this benefit of spending time with our family, but then also your interaction with spending time with your colleagues also play a role in terms of your mental health. And I just wanted to, you mentioned about KPIs and goals, how um, it's possible that maybe working remotely might actually help with achieving your KPIs faster, and maybe even like doing more in a
Yeah.
particular year. So I wanted to get Coach Sarah, what do you think about that, in terms of, for someone that is an HR specialist, have you noticed a difference with your experience, that with remote working, KPIs have changed, and also, are people doing more in terms of KPIs now compared to before?
Thanks, Dr. Bello, for that question. So, in terms of achievement of KPIs and work objectives, either working remotely or not, I think for me, really, it starts with ensuring that the employees are very clear what their set objectives are and their KPI. And that's one critical role that their business leaders, their team leads, their function heads, or whoever is responsible for their own unit. That's what they need to ensure that they are clear, they are signed off work objectives with their team members. Now, I must also say here that with the advent of working from home, there's also been a bit of shift around how people manage their team members. It's no longer having all your team at the workplace where you can see them, you can interact with them. But now some of them have to work remotely. In most cases, the entire team have to work remotely. One of the things that has helped over the given period of time now is ensuring that the team aligns on what the objectives are, and there's effective communication to drive that, right? And in addition to that, there are also scheduled regular meetings with your respective team members, just to ensure you check in on them, to ensure that they are aligned and no one feels sort of lost or lonely alone working in a team. In addition to that, there are equally check-in periods on the KPIs, maybe monthly, weekly, And some people hold operational meetings, and the whole essence of those meetings is just to also check in on one another, check in to understand where are you in terms of delivering of your KPI. Because really, the focus has largely changed from tracking activities to tracking results and outcome, which is productivity, like Aproko Doctor rightly mentioned. So because now you are more or less in your own space, working alone, right? You're clear what your expectations are, then you have to deliver on that. How you do it, a lot of leaders don't really care how you do it because you are not visible to the entire team. But it's more around structuring how you work and delivering to drive productivity. A lot of team members also leverage on technology. There are loads and loads of technology now that teams use to document their work, to track statuses, to reach out, to chat, and also to sort of create that social collaboration and connection. Like you rightly said, sometimes when you work remotely, there is that feeling of loneliness. Sometimes you're unsure, what are my team members doing at this time? You don't even know what they're doing, and you might feel some sort of being alone. So there are lots of technology that you can reach out to people at any given point in time. However, I must also say that one of the challenges with that is there are concerns around there are no blurry there have no blurry clear lines. I'm sorry, the lines are sort of blurry now with regards to what is work time and non-work time. Because when you work remotely, you get to work longer
Yeah.
hours, and sometimes a lot of people also feel their managers and leaders don't respect their time anymore. They send mails to you at odd hours. I remember a friend telling me about a couple of weeks back that our MD sent her an email at 1 a.m. with please respond immediately. And she was like, how am I supposed to respond immediately at 1 a.m.? So there's some sort of concerns
Yeah.
around no more respect for personal time or non-work time. So from a team's perspective, a lot of there are lots of concerns around that. There are also concerns around pushing yourself to the extreme just to continue to deliver because perhaps technically, in some sense, people feel you have more time. After all, you're not in traffic, you're not commuting to work. So use the time wisely and deliver on work. So, but back to your question, I think there are concerns around how we manage time as teams, supporting and working together remotely. But also lots of opportunities for people in that area.
Thank you so much, Coach Lara. That's very, very insightful. Just building on what Coach Lara has said and about the impact of this, apropos doctor. Now, looking at it from the medical perspective, in terms of health implications for remote working, now it really isn't. There's still that balance of it can go to different ways. We talk about how remote working, so if you're working remotely you might be eating healthier generally, or
Yeah.
if you're working remotely you may actually tend to shift to eating unhealthier because you might just have that junk, like you just want to snack on something regularly, and you're taking a lot of unhealthy things in terms of like your diet. So from the medical perspective, what are the impacts? What impacts does remote working have in terms of our physical health?
I think it depends primarily on the person, not necessarily the place of work. Because if you say remote working is unhealthy, then what makes uh, the other option unhealthy? Because you're working at both situations. Yes, are there factors that prevent certain things from happening that become easier when you're remote working? Yes, but at the same time, it depends on on the individual to be able to take advantage of the fact that they're working remotely to be able to take better care of their health. For instance, I have a smartwatch that reminds me to stand up and walk around every hour. It is something that has now become habit. So if I'm sitting for too long, it gives me a reminder. I stand up and I walk around. But there are people who are working remotely from their homes that don't stand up to walk around. They just sit at a spot all day. And depending on the kind of work you do, I don't think there's any job anywhere that says you must sit at your desk. Coach Lara can correct me if I'm wrong, but I don't think there's any job anywhere except for bank tellers. Even as a doctor, when I was involved in seeing physical patients, there are
You have
times
to go
when
on
I would
breaks.
just,
Yeah.
yes, I would just want to take a break, stand up, walk around, talk to people, and then come back to my seats. So it depends on the person. Yes, some people will make the argument that when you're remote working, you tend to eat healthier. That is true because the options at the workplace tend to be limited. For example, some people can't afford to buy meals from the canteen next door or the restaurants, in the next at the next building, but they can afford to just walk into their kitchen and whip up something. So these are it still depends. It still depends on the person. Are there benefits to remote working? Yes. Number one is that some people can take power naps, and power naps have been shown to give a boost in productivity. Power naps have been shown to help a person's mental health, especially when you're focused. Power naps have been shown to reduce a person's level of stress. I keep telling people you can't avoid stress, you can only manage it. And it's easier to manage it when you're working remotely. So you can feel some sort of pressure and decide to take a break off your computer, which is basically where all these things are happening, and take a break. But it is usually difficult, and that's me trying to take the place of the average person working in a corporation. It is not that easy for you to just take a break from your computer without somebody walking by your desk and asking why is Dr. Bello not at her desk? And Dr. Bello says I'm taking a break. It just these are some of the things that can be put into perspective. So it depends. It depends on the person. It depends on whether that person is able to use the advantages of both remote working and working at a physical location um, at a workplace, so to speak. So yes, there are power naps. Yes, a person can eat healthy. Yes, a person can walk around. These are just some of the benefits that you can place on your heart. Yes, the pressure on remote working, it's still 50-50. Yes, are there employers who would not respect your time and send you mail at 1 a.m. and ask you to respond now? Yes. But some people, if you are to take a survey, some people would say, I don't feel that need what's to do what we commonly refer to as eye service. And that pressure is taken away from them. So they're able to just focus on the work and
And
do
that
what
that
they're
can actually affect like your impact, your KPIs and goals. Like you've been able to
exactly
do more even
exactly
with even with the time actually. So there is that
exactly.
benefit of that too. And
So
I
for yeah, you
sorry.
wanted to say something?
Yeah, so just building on that is that about it's really about the person, and but
Yes.
then there's also the place of organizations supporting the person too. Yes, so we tend to focus and say yes, definitely about the person, and just to throw this at Coach Sarah, what can organizations do to better help the person? I think that's my question. What can an organization do to better help individuals, especially with talking about these health benefits and like getting that balance in terms of your health? What can organizations do to better support their staff? Yes.
All right, thank you so much, Dr. Bello. So, in terms of what organizations can do, it's really around the policies and initiatives that the organizations can put in place to help support remote working. For instance, for us here, we have flexi work hours, we have policies and guidelines, we have health tips that we share to our employees regularly, just to some sort of remind them, right, on what they need to do. Just like Dr. Aproko rightly mentioned, it's the responsibility of the person, of the people, to ensure that they prioritize their health, and they also get involved in activities that would help them stay healthy. So it's more around coming up with initiatives from the organization perspective on what they can do, on how they can help the employees to be better aware of tips, initiatives that would help support their work from home. I know for some organization, they also tend to support in terms of benefits for their people. It's based on what the organization is able to do, because we have different organizations at different level. For us, like I'd mentioned, we send health tips to help our employees who work remotely. We also sort of have like what we call safety moments, which means at the beginning of every meeting, we are talking about health, something we are talking about health and safety programs, initiatives to sort of create that awareness and consciousness organizationally so that people begin to pay more attention to their health. We encourage people to take breaks. We encourage people as much as possible to come up with whatever works well for them within their homes. We encourage people to use the right kind of work spaces and work tools that can help support them. So organizationally, it has to be driven from top below. The entire leadership or the management have to show care and concern around ensuring that the employees stay healthy to help drive productivity, and then document that in a form of policy initiatives. Some companies do team bonding activities. Some companies do virtual bonding activities. All in the name to help drive well-being, especially mental and physical well-being while working remotely. I would like to share a personal experience listening to Dr. Aproko. There was a time I was working, I was working for extended hours, and honestly, sometimes these meetings never end. Even weekends when you should have your me time, there's one training, there's one program, there's one event, online, Sundays, church active, online church, everything is online now. Everything is online. There was a time I started feeling some sort of pain at the left-hand side of my back. And that was a message. Immediately, I observed that I'd been sitting for too long. I ensured, one, that I started working daily. I had a target step that I should be taking on a daily, which I track on my phone, on a daily basis, which I track on my phone. I started exercising. I started performing some sort of activities at my desk. I realized that whenever I'm coaching virtually, if I'm on the phone or if I'm on the call, I take my calls while working, and before I knew it, the back pain disappeared. And that got me thinking that a lot of times our body sends us the message. Our body talks to us. And we need to begin to pay attention to our body. Sometimes that slight headache might be you have not drank enough water today. You've just been working all day. There are days I work from home. I don't remember breakfast until 12 noon. And I'm like, oh, really? And I've been here since 6 a.m. So please, we need to listen to our body. Dr. Aproko, you can attest to that, as well as Dr. Bello. When we talk about illnesses don't just come out of the blues. There would have been signs that that our body might have been feeling strange, feeling different. As much as possible, we need to pay attention to our bodies. In addition to that, a lot of companies as well come up with initiatives that further help drive activities that promote mental well-being and physical well-being. That we have HMO programs as well. Lead will also have something fantastic that they do that helps people to get.
Oh, I think we've had this slight network connection. Let me just direct this to while we wait for Coach
To getting active even while working remotely. Apologies, I'm back. I'm back. Can you hear me now?
Yes.
Can you hear me now?
Yes.
I'll wrap up. Yes. So in terms of organization, yes, the organizations can come up with initiatives, but I also think we as individuals need to focus more on health. One of the things that I do now to just help me also manage my mental and physical health working remotely is I joined a dance class. So in the evenings when I come back from work, I zoom into a dance class and I'm dancing. It helps me distress. Then I go home and and I relax. So there are lots of initiatives that we need to start paying attention to, and we also need to start optimizing. Thank you.
Yes. Yes. Thank you so much, Coach Lara. And just you've mentioned very you've with your personal experience, you've been able to give us some tips really to help with our health generally with working remotely. And just to pass the baton back to Dr. Aproko Doctor. So are there any other tips you would like to share with us, apart from what Lara has mentioned about how to better improve our physical health while working remotely and even
Yes. So,
mental health?
okay. Yeah. So, based on what you said, don't move around. Don't sit down for long, because whether you're working remotely or from a physical location, sedentary lifestyle has been associated with, the risk of death. And as much as you can, if you can, what I would advise is, if you can get a standing desk, for instance, you can have a place where your table or your computer is at, chest level. You can just go there, stand for a few hours, sit, work. The basic thing for you is to keep moving around while you're working. You do not, most times, you may not have that, because some of these corporations are, still learning. Some of them are still trying to implement certain things to help employees. And it may not be that process may not be as fast as you want it, but you have that liberty at home. So stand, walk around, move around as often as you can. There is no limit to how much steps you could have in a day. So move around as often as you can. Number two, don't fall for the temptation of not eating healthy. Because yes, you say you are at work and you have limited access to food. Sometimes when you're working at home, there's also that temptation to want to over focus on the work and make excuses for eating unhealthy. So you go to your fridge and a few snacks there, one or two junks there. There's some chocolate in your cupboard. Before you know what's happening, the person has taken 4 or 5 of those chocolate bars in one day, and it's fast energy, so to speak. There's a soda in the fridge. They take it and all that. So you also need to not fall for that temptation of not eating healthy. Another thing that I can also say is, depending on the nature of your work, if you don't need to interact with a lot of people, for example, customer care and interaction on the phone, you can work from different locations, because at some point in your house it gets boring. It's the same thing over and over again. You're probably enclosed by 4 walls in your house. But there are times I take my laptop and I go to an eatery and just choose a corner somewhere, get food, and I'm working. So the fact that it's remote work doesn't need to be in your house. You can work from anywhere. And also learn to take breaks off work. Learn to take breaks, learn to take naps. You can have a power 15, 20 minute power nap when it feels like your mind is befuddled and you can't seem to make sense of what's happening. It's your brain trying to send a message to you that, look, there's a lot of pressure. And at this point, I think I just need to take a break. We do that with our phones. When your phone battery is low, you charge it. When your mind is befuddled, you should take a nap. When you find out that it looks like your phone is, freezing or hanging, so to speak, what do? You simply press the restart button. But when it comes to ourselves, we feel, oh no, I
Forget
just have to power through,
that.
keep going. And the quality of your work reduces, because you are trying to work at probably 40% efficiency, and that's not going to give you
Yeah,
the
so
results
it's
that you're
it's
looking for.
affecting your health as a person, and it's even
Yeah,
affecting your productivity at work too.
exactly.
So
So
you have to
social
take that
contact
break.
also, especially, social contact. Try as much as you can, walk around, meet people, walk downstairs, talk to your neighbor. How are you doing? What has the day been like? Walk back upstairs or downstairs, wherever you live. You basically just keep that social contact. Sometimes, yes, people talk about the evolution of mankind, Web 2, Web 3. We're currently having a life of different locations, but I've also come to realize that there's something that comes with meeting another person physically and having that physical interaction with them. I'm able to read their body language. I'm able to, look at certain inflections in their tone and, basically have that social contact. So eat healthy, move around, don't sit for long periods, ensure that you maintain social contact, get a standing desk, work from different locations if you can.
Thank you so much. And really building on some of the tips you've given, I know at Leadway Health, for as an organization that provides HMO services to companies, we make sure that all our enrollees get access to nutritional stores, which is very, very key about promoting healthier choices for people. And so we provide that they can get access to these stores, they get discount at these stores. So they're getting we're not just telling you that, oh, you
Mm.
get you get these things. We're providing you with cheaper options, and you're getting this. We provide our enrollees with tips on the go to make sure that they're getting the best value for their health. And also, I mean, if you go to our different pages now, you can see, for anyone looking for exercises you can do at your desk, you can actually go to our different social media platforms, on LinkedIn, on Instagram, on Twitter, and you can see exercises that you can do at your desk. Yes, our Procure doctor is already showing us some of the things you can actually do while at your desk, just to further improve your physical health, which is very, very key. And really, in terms of mental health, making sure that you have access to, like, telemedicine. There's a lot of push for telemedicine services, a lot of push for mental health services that you can get on the go, which is part of what you can actually get as an enrollee with Leadway Health. You can get access to a team of mental health specialists on the go. Call them wherever you are. If you just need somebody to talk to, they're always available to talk to you and help with dealing with some of the challenges that you may face while at work, or in terms of, like, your mental health. Really, just talking about mental health generally. So, Coach Sarah, you mentioned previously that um, with kids, working with your kids at home, it's a bit tricky, and the dynamics is pretty different for somebody that has dependents, kids living with them while working remotely, and then for somebody that doesn't have it. The dynamics in terms of even the impact on mental health is different for people that have that interaction when they have dependents that stay with them while working remotely. Can you share a bit of your experience and pros and cons you feel about this?
All right, so I'll share a bit around my experience with a particular team member. So in 2020, when we had to initiate the work from home due to COVID-19 pandemic, it was the first time in the industry where I currently work. We had put together some sort of work structure and all of that. But I remember that when we started, there was a particular team member who is a young mom of two children under the age of 5. The first day we started the work from home, she was not online throughout morning till evening. And the next day, I realized that her meals started dropping at 7 p.m., 7 p.m. to 1 a.m. thereabout. Okay, I didn't say anything. I observed. The next day again, it was the same thing. Her meals didn't come in until she was not able to respond to her work until 7, then till midnight. By the third day, I had to reach out to her as our team. Then I asked her, "Is everything okay? I mean, you were offline all day for 2 days. What is going on? I mean, you're meant to work from home." And then she opened up and said, due to the COVID, there was no one available at home with her. And she had two active kids. So practically during the day, her kids are demanding a lot of our attention, and she couldn't even cope with work. And I said to her, we can't continue like this. So what can we do? What are the options for you? And she thought about it, and then she came up with an idea to invite the lesson teacher home who would come in and stay so that she can concentrate on work. And we agreed that would be a good option. And she by the fourth day, because we had this conversation on the third day, by the fourth day, everything became normal. What am I trying to bring out of this? So first is when it comes with working mothers, it's a bit different because you have the attention of your kids that you would like to pay attention to. You have a couple of things running at home. And we women, we are sort of known to be able to multitask. In the process of thinking we can multitask, sometimes we thin out, right? Sometimes we stretch ourselves. We want to do so many things at the same time. So for mothers, I think it's different for everyone. Sometimes you have to, it's important you get the right support first and foremost. The right support is important. That's one. It's also important that you schedule your activities at home. So for me, early in the morning before work really starts, I'm paying attention to my kids. I'm getting them ready for school. Trying to make breakfast or work with a nanny and all of that. But by the time work starts, the kids, for kids that, yes, to a large extent, if they are home, right, you need to be able to get someone that can keep them busy or keep them occupied. But sometimes it's okay to, if they need attention or something is happening, you can leave work and quickly attend to them, then come back. And sometimes you get them engrossed, you have give them their own tab or give them a toy or something to play with and get them engaged. So it's a different ball game for mothers. A lot of times, I personally sometimes I feel drained at the end of the at the end
Yeah.
of the day, having the need to attend to kids, and of course my work is very demanding. I also
Like, who,
support
who takes care of you?
who takes care of me at the end of, I have to take care of myself. So for working mom is different, but please, it's important we find what works for us. It's important we find support that can help us. And most importantly, as mothers, find time for yourself, me time. So there's something I just say, Daddy, it's over to you. Please, I need some me time. I need to rest. I need to sleep. I need to stretch. I need to go to the spa. Yes, I need a massage. I need to pay attention to myself. Sometimes I just switch off my phone and please, mommy needs to rest. So it's really critical that as mothers, we pay attention to ourselves. Sometimes you are even in an environment where you have your siblings. If you're single, maybe you have your siblings that are all active.
Yeah.
You're all grown and you're all in the same house, and yet someone is playing music in room A, meanwhile you're in room B trying to, trying
Work and
to,
type that last
trying to sort of
email.
work in the. There was a time I was in a meeting with a vendor, and her generator noise was all we heard throughout the entire call because of where she stayed. So all of this, there's lots of challenges that women face, working from home. But at the same time, it's for us to understand what works well for us, put a structure, put a support system, and then pay attention to your health.
Very, very key. And that's very, very, thank you so much, Coach Clara, for that. Pay attention to your health. Make sure that you have access to, good health services. That's very, very key because we can't get lost in the mix and not remember to focus on ourselves and know that our health is a priority for us as individuals. And so, even in the mix of being productive and giving your best, don't forget about your health and make sure that. And um, as an HR person, as you've mentioned, making sure that your staff get access to good, proper health services that can help with making sure that their mental health is protected, their physical health is protected, and that's not a problem for them, so that they can give their 100% always, which is very, 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 very key. Um, just just to talk slightly about depression while working remotely, and I'm pushing this to a Aproko doctor. Um, it's challenging. It's honestly challenging,
It
as
is.
we kept on mentioning about how that working, even though you work at home and you might have like family members around you, there's still a risk of social isolation and all. What can you just share some tips that might help in terms of like mental health and depression while working remotely?
So yes, depression can be from a couple of other factors aside from just social isolation. Sometimes it could be that a person does not really unplug from work, and that happens. A person closes their laptop or closes their computer or gets off the phone, but they still carry that work around. They forget to unplug. Now, because you're carrying this weight around, it could be a lot of pressure for one person to handle. And if that person does not have that supportive social circle around them, they tend to break down, they tend to burn out because you're always 24/7 thinking about work. You're always, always, always on the burn. You're always thinking about work. So I think it first starts with understanding your limits, first of all. The fact that you're working from home does not mean you're supposed to work 24 hours a day. It means that you're supposed to set aside time for yourself as a person. There should also be self care that is incorporated into your daily schedule so that you don't burn out, so that you don't suffer from depression. Because, yes, yes, there's social isolation, but if you don't create that, which takes me to my next topic, which is creating a schedule. If you ask people what is the major thing that you love about working from home or working remotely, one of the things that they will tell you is they love the fact that their schedule is not flexible. But we also need to understand that sometimes having no schedule in your day could also be detrimental to your mental health because it means that there are a lot of decisions that you have to make on the go. Have you noticed that certain people like Elon, not Elon Musk, they are on Facebook, Mark Zuckerberg, and
Okay.
Steve Jobs tend to only appear in a certain color, a certain T-shirt every time they're on stage or every time you see them. It is I had to go research and I found out that they said that it helps them reduce the amount of decisions they make per day because we only have a limited amount of willpower every day. And if you wake up every day thinking, "Oh, what am I supposed to wear today?" So in that particular vein, you also have to create a schedule. So from this time to this time, this is what I'm supposed to be doing. After this period, I'm supposed to do this. After this period, I'm supposed to do this. Now we seem to have that schedule in physical work locations, but when it comes to remote work, we don't have those particular schedules. We just work anywhere. When you're supposed to be eating, you're working. When you're supposed to take a break, you're
It's
working.
it's a
So
total mix.
so the things are just getting into each other's way. So one of the things you need to do in order to avoid this breakdown and depression is first off, try to create a schedule. Number two, understand that you have limits. And there's also this particular option which might work for a lot of people. If you live close to other co-workers, you could take turns working at each other's places.
That's
So
different. Yeah.
yeah, so if I live close to Nkechi, for instance, or I live close to Emeka, and it's just a 5 or 10 minutes drive to his house, I can decide to work from his place. We'll have an agreement. So I'm working from your place today, and while working, we're having that social connection between both of
It's
us.
still
So these
remote
are
working. Yeah.
exactly it's still remote working. So these are some of the things that can help you avoid depression or minimize the risk of depression while you're working remotely.
Thank you so much. I think I've actually never really thought about it from this suggestion you gave about remote working doesn't mean you have to do it alone. You could actually find people
Exactly.
around you and you can actually still work remotely, but you're still having that interaction from other people around you. And that's really, really, really interesting to take note. I hope people have taken note. I have definitely taken note of that and will definitely practice that continuously. Just to, I think we've discussed varied tips and options about remote working, what we can do better. And I mean, it's really just we've kept on saying this about it's really dependent on the person, your situation, what your dynamics are as a person, and that really does affect what would how you would mitigate, what tips you would use, and see how you can better improve your health generally. We'll just take some of the questions. We'll just take some. I apologize if we would not be able to take all your questions. Just some questions from the audience. Um, okay, so I saw a question. Okay, so this is directed at Coach Lara. Um, how can organizations better manage in terms of employee attendance? I think that's what the person is regarding remote working. I know you've touched on some of this during the presentation. Maybe just give us like one or two tips that organizations can do to help ensure that people are actually working when they're working remotely.
Oh, okay. So although I saw Imane Michael's response to that question, which is attendance in terms of work output or attendance in terms of, you're actually doing the work. Like I mentioned earlier, the shift is moving from activity to productivity. It's more around performance, it's more around the result that you deliver, the value that you bring on the table. If your work is remote and you have set KPIs that you need to meet, it's more around, are you delivering on those KPIs? As at when due? Because a lot of time there are timelines that are attached to the delivery of set KPIs and objectives. So are you delivering within timeline? Now, if you have to be in the office physically, for instance, I'm in the manufacturing space. People still have to come to work. The people still have to be able to operate the machines so that we can feed the nation, which we've committed to. If people don't come, we cannot produce flour, we cannot produce pasta, we cannot produce noodles. So people have to come
So
physically.
the
And they
dynamics
are
actually
work
vary with
together.
what work you
Yes,
do.
yes, it varies. So if people have to be in work physically, yes, attendance is critical. And there are structures and consequences that can be put in place in terms of managing attendance. But if it's remotely, how do you track attendance remotely? There are some apps that you can use if it's important, really. So if it's important for the nature of that job, for people to come online as at when due, do check-ins. There are tools that you can adopt to use for that. But otherwise, are you driving attendance for the sake of activities or for productivity and results and outputs, which for me is what is more important compared to just tracking activity. You can be online and I can actually be in front of my laptop. My status will show as green, but I'm on YouTube, I'm on LinkedIn, I'm on other social media platform, and I'm not doing the work I'm supposed to do. So focus should really be on driving productivity, which is results and outcomes as expected, and not just activities based on the nature of the job.
So that's very, very key. The push to more about productivity rather than how many hours you spend at work. But you could spend like 20 hours and still not be productive, but you could actually spend 5 hours. And I mean, talking to what doctor mentioned about having schedules and having something that can actually guide you, taking those reminders, using reminders to let you know what you should be doing at what point in time. It might seem a bit regimented, but it helps with in terms of your health, with your productivity, and just generally improving your lifestyle as an individual. um, I think there's a question directed at um, sorry. So there was a question about someone mentioned about your desk. I think in relation to what Apoko doctor mentioned about um, having a standing desk at your workplace. We don't talk enough also while you're working. We don't talk enough about ergonomics and how those things can actually affect your health, even in not just even now, but like even in the long term. So
Yeah.
just to this is directed to your Aproko doctor. What tips can you give regarding ergonomics while working remotely that can also impact our health now and even for the future?
So first off, if you are working from home and you sit, it is very important that you get a seat that is actually comfortable. We say working from home, but if you spend hours working from your sofa, you find out that your posture is actually going to suffer. Your bone structure is actually going to suffer because you're probably hunched over. I have seen people work from a coffee table while working from a couch. And this person is hunched over for hours. You're going to put a lot of strain on your shoulders. You're going to put a lot of strain on your lower back. So it is important to invest. If you're working from home, try to invest in probably setting a corner of your house, for instance, to be an office space. It could be a small table that has adjustable heights, but it's an investment you're making for your health. It's not just an investment you're making for the company, you're also making it for your health. Because the more, or rather, the healthier you are, the more productive you can be. So invest in an office space, get a table that has adjustable heights. You can raise it up, bring it down, or you get an actual office seat. I'm actually sitting on one right now, and pay attention to the curve of the back. So you have to ensure that there has to be some tension on your lower back. It can't be like a C per se. It should feel more like an S. So that keeps the curve of your spine intact. If you can't get that, what you can do instead is to get a small pillow and place it in between the seats and your lower back till you can get an actual office chair that protects your lower back. So when it comes to ergonomics, so even when you're standing and you're working, your table or whatever you're using to work should be at elbow level instead. And if you're using a mouse, I actually advise that if you're going to use a computer, it is important that you get an actual physical mouse and not just using the trackpad from your computer. So these are just some tips that may help you, ensure that you're not damaging your posture or damaging your body structure while you're working from home. Because we tend to be lax about these things. So I lie down and I'm hunched over on my bed and I'm working. That's a lot of pressure. That's not how we're meant to work as people. So if you're sitting, get a small pillow that protects your lower back, or you get a chair that you can adjust your lower back so that you protect your lower back. If you're standing, ensure that your table is at your elbow level. If you're trying not to be hunched over for long hours if you're working. So
thank you so much. And I think that also answers the question showing, I think, presently now about, there was a question about for jobs that you have to definitely sit for so long, but maybe for 10 hours, for 12 hours, you don't necessarily have to stand up from your desk sometimes to actually do some of these exercises. As I mentioned, you can go to just go to Leadway Health social media platforms. You can see exercises you can do while at your desk. So there are things that you can move your legs while at your desk. You can move your arms right at your desk. So you don't have to, so if your job is the type of, for instance, for someone that maybe is a customer service representative that has to sit for 8 hours or 9 hours at their desk, there are things, even while at your desk, you can actually do as exercises that would help with improving your physical health, your ergonomics generally. And then, I mean, when you're also done with your work, you can also do other things that can also help with improving your health in terms of going to the gym or exercising, which are very, very key things that our enrollees enjoy at Leadway Health. So they get access to their gyms easily. So you get your gym, you don't have to stress about, do I have to pay for gym services? Because those things are not cheap. But if your organization has Leadway Health as their HMO, you will definitely get access to gyms, nutritional stores, because we're always about making sure that our enrollees are healthier and doing better. Just to take I know time is fast spent already, but we'll just take a couple of concluding tips from. I'll start with Aproko Doctor. Any final tips? Any final last words for our audience today about is remote health working healthy?
Yeah, so working remotely, like I mentioned earlier, don't fall for the temptation of just eating whatever you can because you're working. So I usually like to end with this particular snippet is whatever you put in your mouth actually promotes your health or is detrimental to your health. And so you have to ensure that whatever you're putting in your mouth actually helps your health, which is one of the reasons why I must commend Leadway Health that they actually have nutritional stores. Because when we think of health insurance and health support, we think from the fact that when you fall sick, we're going to take you to the hospital and pay for your bills. But people do not think of the fact that before what do I do
Or
to
sick,
even
primary
prevent?
prevention.
Yes, what do I do to even prevent falling ill? So whatever you put in your mouth actually goes a long way to actually promote your health or detriment it. So I hope you're making the right decisions.
Thank you so much, Aproko Doctor. So what you put in your mouth will definitely affect you. What you're putting in your mouth while working in the office or even while working at home remotely will definitely affect. There's no difference in the two. You just have to make that decision to make sure
Mhm.
you're eating healthier at home or working remotely. It's still the same impact for both. Coach Sarah, thank you so much, Aproko Doctor, for that. Coach Sarah, any last words, final tips you would give for individuals and even for organizations regarding ensuring is remote working healthy for their staff and all?
Thank you so much. I'd like to end with a quote by Stephen Covey. It reads, "The key is not to prioritize what's on your schedule, but to schedule your priorities." So, in this instance, your priority is your well being. For organization and for individual, the goal is to drive productivity on the long run so that there can be optimal value. For us as business leaders, our people remains our greatest assets. In this instance, our people remains our priority. For individuals, their health, who is they themselves, they also need to prioritize their health. We need to ensure that we prioritize our mental, emotional, physical well-being so that we can stay productive. And I'd like to also appreciate Leadway for helping to partner with organization to ensure that people stay productive by prioritizing their well-being through the various initiatives that they have, their HMO, access to health, access to preventive health, access to activities that keeps people healthy. On that note, please, everyone, prioritize yourself. You are important and you mean a lot to the world. The world, this instance, is not just your organization, but your existence is important. And then please stay focused on your health. Thank you.
Thank you so much, Coach Sarah. And I mean, you've really, really helped give some very, very, very crucial tips and recommendations, and that's very, very important. Prevention would always be the most important thing. If you're working remotely, if you're working at home, if you're working from the office, it's still your health should always be a priority, and that's why it's very key that organizations have health services that their staff are able to enjoy and benefit maximally for making sure that prevention is always the goal. We don't want to have to trick people when they come down with illness. Can we rather make them healthier even before those diseases come by getting improving physical activity, which they can do via Leadway Health by getting access to gyms, by getting access to nutritional stores where they can get healthier options, by getting health tips from us at Leadway Health, which is very, very key because we're all about prevention. We don't want people to have to reach that point of ailment. If you have any questions, you can also, I mean, reach out to our telemedicine team is always available 24 hours just to even talk to you, give you tips about, which is very, very crucial for your health because there's so much information available, but people don't know about it. And that's very, very key. And we want to make sure that health education is very, very important to prevent diseases. And we also reward you for living healthier, which is very, very key. What we do at Leadway Health to reward our enrollees for living healthier and for doing better generally, and just to ensure that organizations are choosing the right HMO for their staff to make sure that they are living healthier and they are rewarded for living healthier. Because if your staff is healthier, you as a company, your organization is more productive and is able to function more effectively, which is very, very, very key. I would like to for more, if you definitely we've really learned a lot from this webinar. If you want more information about our health plans, please go to www.leadway.com/get-health-plans to get to know about our different covers, our plans, and to know what we're offering and making that change, because we're here to definitely make that change in the society and make sure that people are doing better, enrollees, staff, organizations are healthier generally. Please go to, if you need more information, please, about our Leadway health plans, go to www.leadway.com/get-health-plan. I'd like to thank our guest today, Dr. Chinonso Igemba and Omolara Yeku. They have really touched on very, very important points. I can see so many comments from the comment section about how this has definitely been a great value for our time. And we're really glad that you joined us today to better, to learn more about things we can do in terms of prevention for our health and improving our health generally. This has really been an insightful session for me, and I'm sure it has been for our different guests and organizations here present today. Join us next time for our next webinar, and we hope that you would definitely choose the right HMO for your organization, which is definitely Leadway Health, because there's nothing better, honestly. Thank you so much for joining us today. I hope we would practice these tips from this webinar and make sure that we're doing better for ourselves as individuals. Thank you. Have a lovely afternoon.